Dear students, let us start learning various scenario-based questions that can be asked in the physiology along with the explanation. Let us begin with the case. Here is a patient, Mr. LKJ, aged 50 years. He goes to the doctor and his main complaint is persistent cough since 6 months. And it is productive cough, that means every time he coughs, sputum is coming out. And since 3 months, he could see that it is blood-tinged sputum which is coming. He also complains that he is getting difficulty in breathing, which we call dyspnea, and he gets fatigue very early. There is a significant history of weight loss of around 10 kgs is lost from 6 months, and he also says that he is not feeling hungry nowadays, that is, there is loss of appetite. His other complaints is he feels feverish during evening and also night sweats. Examination was done in the patient and the examination shows pallor present and swollen lymph nodes are present at the neck. His vitals like pulse and BP phones to be normal. BMI, that is body mass index, is 18 kg per meter square. Body mass index is often calculated using weight in kg upon height in meter square, and 18 kg per meter square shows that he is underweight. Clinical examination of respiratory system was performed, which shows reduced vocal fremitus in the upper lobe of the lung, and percussion shows there is tolling dull note, and X-ray was done in the patient which shows nodular infiltrate in the upper lobe of the lung. So what is the probable cause for the above signs and symptoms? So the most probable cause is pulmonary tuberculosis. Which organism causes tuberculosis? Tuberculosis is caused by tubercle bacilli or Koch's bacilli, called as Mycobacterium tuberculosis. It's called Koch's bacilli because it is being discovered by Robert Koch. Tuberculosis is often very common in the apex of the lung when compared to other parts of the lung. The reason is this tubercle bacilli is an aerobic organism which needs more oxygen for it to sustain. Apex of the lung, we see increased ventilation, which favors increased oxygen availability there, which favors the growth of this Mycobacterium tuberculosis. This is the reason why TB is often more commonly seen in the apex of the lung. So what is the altered physiology in tuberculosis? See, what you need to remember is tuberculosis is not because of any toxin which is released by tubercle bacilli, but instead it is because of our immune response. See, whenever any tubercle bacilli enters into the lung, initially the alveolar macrophages will tries to phagocytose it and tries to kill it and destroy it. But if it cannot kill the bacilli, then the cell-mediated immune response will start developing. And this cell-mediated immune response causes more activation of CD4 helper T lymphocytes, which release lot of cytokines like interleukin 2, and this causes more infiltration of macrophages. So this is a very good example of delayed hypersensitivity reaction, which leads after a few months or days there will be formation of tubercle around this tubercle bacilli, and main intention is to prevent the spread of this infection to other parts of the lung, and slowly this part of the lung will getting fibrosed. As this part of the lung will get started fibrosed, so what we could see that there is reduced healthy lung tissue which is available. So this leads to reduced vital capacity, reduced diffusion capacity of the lungs and impaired ventilation, and this causes increased workload on the existing normal lung. So what is the cause for persistent cough that is we see in tuberculosis? Tubercle bacilli release a complex lipid which stimulates nociceptive neurons and irritant receptors present in the lung tissues, leading to the cough. And persistent irritation slowly damage the airway tissues also. What is the cause for weight loss that is seen in TB patients? So tuberculosis is a very good example for chronic inflammation, and where we see chronic inflammation often there is a release of various cytokines like tumor necrosis factor, and this cytokine often reduce the appetite and increase the energy expenditure. This is the cause for weight loss seen in TB patients. So what are the common clinical features seen in tuberculosis patients? Chronic cough, and they also complaining of it's a productive cough and sometimes blood till sputum, history of weight loss, reduced appetite, night sweats, evening rise of temperature, fatigue. These are the common features seen in TB patients. How tuberculosis spreads? Tuberculosis often spreads by air, that is droplet infection. Whenever a person who have active TB, whenever they cough, so generally this bacilli enters to the air and it enters into the lungs and causes development of tuberculosis. And this bacilli can often even spread to other tissues like kidney, spine and cause the tuberculosis.